Hey everyone, John Green here, and today we're tackling a topic that's probably on everyone's mind: the cost of health insurance in America. Let's be real, it's expensive. The average American family pays over $22,000 a year for health insurance. That's like buying a brand new car every year, but instead of cruising around town, you're just hoping you don't get sick. And it's not just families feeling the pinch. Individuals are shelling out an average of $7,000 per year. These numbers have been steadily climbing for years, outpacing inflation and putting a strain on budgets across the nation. But why is healthcare in the US so pricey compared to other developed countries? Let's dive in and break down the factors driving these high costs. One major culprit is medical inflation. Everything from prescription drugs to hospital stays seems to be getting more expensive every year. New treatments and technologies, while amazing advancements, often come with hefty price tags. Think about it. Developing a new drug or gene therapy requires years of research and billions of dollars in investment. Then, there's the mountain of paperwork involved in healthcare administration. Insurance companies, hospitals, and doctors all have their own systems and billing processes, creating a complex and costly web of administrative overhead. And let's not forget about defensive medicine. Doctors, fearing lawsuits, often order extra tests and procedures even if they're not strictly necessary, adding to the overall cost of care. Did you know that the US spends more on healthcare administration than any other developed country? It's true! We spend almost 3 times as much on administrative costs as countries like Canada and the UK. That's money that could be going towards actual medical care, not just processing paperwork. And then there's defensive medicine. Doctors are often caught between providing the best possible care and protecting themselves from potential lawsuits. This can lead to unnecessary tests, procedures, and longer hospital stays, all of which drive up costs. It's a tough situation, and one that contributes to the high price of healthcare in America. As we age, we tend to require more medical care. It's just a fact of life. And with the baby boomer generation entering their golden years, the demand for healthcare services is higher than ever. Chronic diseases like diabetes and heart disease are more common in older adults, requiring ongoing treatment and management. This aging population puts a significant strain on the healthcare system and contributes to rising costs. It's a complex issue with no easy solutions, but it's important to understand the role demographics play in the cost of healthcare. The Affordable Care Act, or ACA, was designed to expand health insurance coverage to millions of Americans, and it did just that. But it also came with some trade-offs. The ACA introduced new regulations and mandates for insurance plans, which increased coverage but also added to the cost. For example, the ACA requires plans to cover essential health benefits like maternity care and mental health services. While these are important benefits, they also increase the overall cost of insurance premiums. It's a balancing act between providing comprehensive coverage and keeping costs affordable. Okay, so we've covered some of the reasons why health insurance is so expensive. But what can we do about it as individuals? The good news is, there are steps you can take to save money on healthcare without sacrificing quality care. First and foremost, shop around. Don't just settle for the first insurance plan you come across. Compare plans from different providers, looking at premiums, deductibles, and out-of-pocket costs. The government-run health insurance marketplaces are a great place to start your search. They offer a variety of plans and can help you determine if you qualify for subsidies to lower your costs. When choosing a plan, consider your individual needs and healthcare usage. If you're young and healthy, a high-deductible plan with a health savings account, or HSA, might be a good option. These plans typically have lower monthly premiums, and the HSA allows you to save money tax-free for future medical expenses. However, if you have chronic health conditions or anticipate needing frequent medical care, a plan with a lower deductible and more comprehensive coverage might be a better fit. It all comes down to finding the right balance between monthly costs and out-of-pocket expenses. Now, let's think outside the traditional insurance box for a moment. Alternative care models, like direct primary care and telemedicine, are gaining popularity as more affordable options. Direct primary care involves paying a monthly fee to a doctor for unlimited primary care visits. This can be a great option for people who need regular checkups or have chronic conditions. Telemedicine allows you to consult with a doctor remotely via video chat or phone call. It's a convenient and often more affordable option for non-emergency medical needs. Plus, it's perfect for those times when you can't make it to the doctor's office. One of the best ways to save money on healthcare is to stay healthy in the first place. Preventive care is, honestly, just so crucial. Regular checkups, screenings, and vaccinations can help catch health issues early on, when they're easier and less expensive to treat. Many employers offer wellness programs that encourage healthy habits. These programs may offer discounts on gym memberships, health coaching, or even financial incentives for participating in healthy activities. Taking advantage of these programs can benefit both your health and your wallet. New hospital price transparency rules are giving patients more power than ever before. Hospitals are now required to publish their prices online, allowing you to compare costs for different procedures and services. This transparency can help you make more informed decisions about your care and potentially negotiate lower prices. And speaking of negotiation, don't be afraid to negotiate your medical bills. Medical billing errors are more common than you might think. Carefully review your bills and don't hesitate to question any charges that seem incorrect. You can often negotiate lower prices or payment plans with hospitals and providers. While individual actions are important, we also need systemic change to address the root causes of high healthcare costs. Support policies that promote competition in the insurance market, lower drug prices, and reduce administrative waste. Contact your elected officials and let them know that affordable healthcare is a priority for you. Together we can advocate for reforms that make healthcare more accessible and affordable for everyone. So there you have it. The high cost of health insurance in America is a complex issue with no easy solutions. But by understanding the factors driving these costs and taking proactive steps, you can navigate the healthcare system more effectively and save money. Remember to shop around for the best insurance plans, consider alternative care models, prioritize preventive care, and don't be afraid to negotiate your medical bills. And most importantly, let's continue to advocate for policy changes that make healthcare more affordable for everyone. Stay healthy and informed, everyone.